Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the glaucoma, what is the treatment of glaucoma? For the treatment of glaucoma, we can give goniotomy is done. Goniotomy is actually the surgery of choice which is done in the for congenital glaucoma. So in this procedure, a cut is given along the angle. Through the angle, here gonio is angle, tummy is cut. So here along the angle of the anterior chamber, a cut is given along the angle of the anterior chamber in this type of congenital glaucoma. In goniotomy, the second type is trabeculotomy. Trabeculotomy, here we cut open the Sclem's canal. Here a cut is given at the trabeculae or Sclem's canal. This is done if the cornea is hazy or if there is difficulty in visualization of angle. If the angle is not visualized or if the cornea is hazy, then we do this trabeculotomy. Combined trabeculotomy and trabeculectomy can also be done in congenital glaucoma. So these are the treatment options for congenital glaucoma.
thank you and thank you for watching.